बिस्मिल्लाहिर्रहमानिर्रहीम। Assalamu alaikum. Today we will discuss the conditions that cause the excessive bleeding in human beings. For that purpose, mainly we classify the bleeding disorders into three categories. The bleeding disorders may be occurring due to the defect of the blood vessels or the disorders regarding platelets or defects of the clotting mechanisms. The diseases which may occur due to the defect of blood vessels, they include the vascular purpura, for example typhoid, septicemia, or occurring from chemical agents like aspirin, due to the metabolic defect like uremia, hepatic failure, or vitamin C deficiency. All these, they are due to the defect of the blood vessel. The disorders occurring due to defective platelets, either the number of the platelets lesser than normal or more than normal, or the platelet function is defective. The disease due to the decrease in number of platelets, that is the thrombocytopenic purpura. Excessive platelets occur in thrombocythemia and defective platelets occur in thrombocythemia. The disorders due to the defects of clotting mechanisms include congenital and acquired. Congenital defects may be hemophilia and its other types, or the deficiency of other clotting factors. It may be acquired, for example vitamin K deficiency due to the oral anticoagulant therapy, or the advanced liver disease. So dear students, you must remember this classification of bleeding disorders. Further, we will discuss just the important diseases like vitamin K deficiency, hemophilia and its other types, thrombocytopenia, which is actually the platelet deficiency. We cannot cover all types of the bleeding disorders, so just focusing these disorders, we will discuss them in detail. But you must know exact classification of all the disorders, bleeding disorders. So remember the classification, but in detail we will discuss only these three important disorders: vitamin K deficiency, hemophilia and its other types, and thrombocytopenia. The number one is the vitamin K deficiency. It may occur due to the diseases of the liver, for example hepatitis, cirrhosis, or any other disease regarding liver, or due to the vitamin K deficiency. As we have discussed, that depressed formation of clotting factors by the liver is due to the vitamin K deficiency. So it is going to affect many of the clotting factors. Regarding its signs and symptoms, bruising, petechiae, which is the very small pinpoint hemorrhages. So underlying skin, in the subcutaneous tissue, you can find a number of these bleeding spots. Purpura or petechiae purpura is a condition of red or purple discolored spots on the skin that do not blanch on applying pressure, and petechiae is through physical trauma such as hard bout of coughing, holding breath, vomiting or crying like that. And it can occur like that bruise caused by a blunt object or around the eyes bilaterally called the bilateral periorbital ecchymosis. Now comes the hemophilia and its types. We can have hemophilia A, we can have hemophilia B, and one more type of the hemophilia. What is the difference? The difference lies the deficiency of the factor. Which type of the factor is deficient? If there is a deficiency of factor 8, it is called the hemophilia A or classic hemophilia. If there is deficiency of factor 9, then it will be the another disease, that is the Christmas. This Christmas disease, which is called the hemophilia B. Coming again to previous slide, this one, and we have another type. I will discuss these separately, but you must appreciate the bleeding disorder. This is the normal clotting. You can see the platelets, they are coming in contact with the injured site and making the platelet plug formation, and after that more and more clotting factors will come to this side, while inability to form clot, that is it. Because of this deficiency, you can have continuous bleeding. The bleeding state in hemophilia can have various degrees of severity depending on genetic deficiency. Factor 8 has two active components. You must remember this. Because of these two active components of one single factor, we can have two different diseases. The smaller component is most important in the intrinsic pathway for clotting, and it is the deficiency of this part of factor 8 that causes the classic hemophilia or the hemophilia A. So you must remember that factor A actually has two active components. One is larger and one is smaller, and in the hemophilia A or classic hemophilia, the defect lies in the smaller component. Another bleeding disorder, which is called the von Willebrand's disease, results from loss of the large component. So, regarding factor 8 deficiency, we have two diseases because of its smaller and larger components, and one more disease which is due to the deficiency of factor 9. It will be the hemophilia B. This is a patient in which a slight bleeding. You can see how the small injured side from blood coming from the small injured side going on the face of the patient, and you can see the how much the speed of the blood. This is the X-ray showing hemophilic enteropathy with the moderate effusion, change occurring on the X-ray, decrease joint space, subchondral erosion, and the physis is narrow compared to the other knee. Now comes the hemophilia B, which is actually the deficiency of factor 9, and the other name is Christmas disease. It is X-linked and less common than the hemophilia A. Dear students, you must know all the types of the hemophilia because they are many times they are asked in Viva and they come in MCQ, and even you can have the SCQ about the hemophilia, then you have to explain all these things. Hemophilia A, hemophilia B and von Willebrand's disease. And the treatment is the replacement therapy with the deficient factor. Now coming to the next platelet disease, that is the thrombocytopenia, in which we have the less number of platelets. Small vessel hemorrhages because needed for repair of minute breaks, purpura, petechiae or pinpoint hemorrhages, they are present. Mucous membrane, gingival, GIT, urinary or nasal bleeding can occur, and maybe cerebral hemorrhage also present. All these combines to show serious hemostatic problem. In the idiopathic type, the exact cause is unknown, and specific maybe the specific antibody react against the platelets. Treatment includes the whole blood transfusion and splenectomy. This is a table in which I am showing the difference between the platelet disorders and the coagulation factors defect or deficiency. If there is platelet disorder, the onset of bleeding will be immediate. In case of any deficient coagulation factor, it will be delayed. Duration for the platelet disorder, it will be the lesser than 40 hours, while in case of coagulation factors deficiency, it will be prolonged 2 to 3 days. Platelet disorders can be stopped, bleeding can be stopped on local pressure, while coagulation factors defect that cannot be stopped with the pressure. Delayed frequent bleeding that is not present in the platelet disorder while it is present in coagulation factor deficiency. Regarding site and character, in the platelet disorder, skin purpura that is present, while coagulation factor deficiency includes mostly in the muscles and subcutaneous tissue, and ecchymosis that are small hemorrhagic spots on skin or mucous membrane forming non-elevated rounded or irregular blue or purplish patch. With this we cover the bleeding disorders. So till the next lecture, thank you and Allah Hafiz.